Welcome to Pinoy Medical Coder. ICD-10 CM Official Coding Guidelines. Today, we'll be discussing about supplement coding encounters related to coronavirus outbreak, also known as COVID-19, effective February 20, 2020. Before we proceed, don't forget to like our Pinoy Medical Coder Facebook page to learn more about medical coding. The purpose of this video is to provide official diagnosis and coding guidelines for healthcare encounters and deaths related to the 2019 novel coronavirus, COVID-19, previously named 2019 NCOV. The COVID-19 caused an outbreak of respiratory illness, and was first identified in 2019 in Wuhan, Hubei Province, China. Since then, thousands of cases have been confirmed in China, and COVID-19 has also spread internationally, including in the United States. Investigations are ongoing. The most recent situation updates are available from the CDC webpage, about 2019 novel coronavirus. The confirmed COVID-19 infections can cause a wide range of illnesses, from little to no symptoms, to those affected being severely ill and even dying. Symptoms can include fever, cough, and shortness of breath. Symptoms may appear from 2 to 14 days after exposure, based on the incubation period for other coronaviruses, such as the MERS, Middle East Respiratory Syndrome, viruses. This guideline is intended to be used in conjunction with the current ICD-10 CM Classification and the ICD-10 CM Official Guidelines for Coding and Reporting, effective October 1, 2019, and will be updated to reflect new clinical information as it becomes available. The ICD-10 CM codes provided in this document are intended to provide information on the coding of encounters related to coronavirus. Other codes for conditions unrelated to coronavirus may be required to fully code these scenarios in accordance with the ICD-10 CM Official Guidelines for Coding and Reporting. A hyphen is used at the end of a code to indicate that additional characters are required. General Guidelines. Pneumonia. For a pneumonia case confirmed as due to the 2019 novel coronavirus, assign codes J12.89, other viral pneumonia, and B97.29, other coronavirus as the cause of diseases classified elsewhere. Acute bronchitis. For a patient with acute bronchitis confirmed as due to COVID-19, assign codes J20.8, acute bronchitis due to other specified organisms, and B97.29, other coronavirus as the cause of diseases classified elsewhere. Bronchitis not otherwise specified due to the COVID-19 should be coded using code J40, bronchitis, not specified as acute or chronic, along with code B97.29, other coronavirus as the cause of diseases classified elsewhere. Lower respiratory infection. If the COVID-19 is documented as being associated with a lower respiratory infection, not otherwise specified, or an acute respiratory infection, NOS, this should be assigned with codes J22, unspecified acute lower respiratory infection, with B97.29, other coronavirus as the cause of diseases classified elsewhere. If the COVID-19 is documented as being associated with a respiratory infection, NOS, it would be appropriate to assign codes J98.8, other specified respiratory disorders, with B97.29, other coronavirus as the cause of diseases classified elsewhere. ARDS. Acute respiratory distress syndrome may develop in with the COVID-19, according to the interim clinical guidelines for management of patients with confirmed 2019 novel coronavirus infection. Cases with ARDS due to COVID-19 should be assigned the codes JAD, acute respiratory distress syndrome, and B97.29, other coronavirus as the cause of diseases classified elsewhere. Exposure to COVID-19 coronavirus. For cases where there is a concern about a possible exposure to COVID-19, but this is ruled out after evaluation, it would be appropriate to assign the code Z03.818, Encounter for observation for suspected exposure to other biological agents ruled out. For cases where there is an actual exposure to someone who is confirmed to have COVID-19, it would be appropriate to assign the code Z20.828, Contact with unsuspected exposure to other viral communicable diseases, signs and symptoms. For patients presenting with any signs or symptoms, such as fever, etc., and where a definitive diagnosis has not been established, assign the appropriate code for each of the presenting signs and symptoms such as R05 Cough, R06.02 Shortness of breath, R50.9 Fever, unspecified. Note: Diagnosis code B34.2, Coronavirus infection, unspecified, would in general not be appropriate for the COVID-19 because the cases have universally been respiratory in nature, so the site would not be unspecified. If the provider documents suspected, possible or probable COVID-19, do not assign code B97.29. Assign codes explaining the reason for encounters such as fever or Z20.828. This coding guideline has been developed by CDC and approved by the 4 organizations that make up the cooperating parties: National Center for Health Statistics, American Health Information Management Association, American Hospital Association, and Centers for Medicare and Medicaid Services. For more details, please check reference below or visit the CDC website. Thank you for watching.